welcome to another episode of The Doctor is In. Today our podcast is about Parkinson's disease. My name is Emma De Freitas. I am the Movement Disorder Coordinator here in Cleveland Clinic, Abu Dhabi. I am delighted to be able to interview Dr. Shivam Mittal, our Movement Disorder Specialist and head of our section of movement disorders, who will help us to dispel some of the myths surrounding Parkinson's disease. Dr. Shivam, you are very welcome to the podcast.
Thank you, Emma, for having me here. I'm excited to discuss about Parkinson's disease myths in the UAE.
So we're going to start our podcast today by asking you to give us a brief summary around what Parkinson's disease is.
So Parkinson's disease is a neurological condition. It's a brain condition. There is a dopamine producing cells in the brain which die over time. As a result, the movements of the body become slowed down. People can have tremor symptoms or shaking, or also muscle stiffness and tightness. These are the movement symptoms or the motor symptoms, but there are also non-movement symptoms such as constipation, anxiety, depression, low mood symptoms, pain symptoms, sleep disturbance, lack of smell sensation. So there are a lot of non-motor and motor symptoms which complete the picture of Parkinson's disease, and the numbers are growing worldwide. If you look at the study recently published, we know that the numbers of Parkinson's are doubling. By 2050, the numbers of Parkinson's will be about 25 million. So 1 in every 500 may suffer from Parkinson's disease, which is a huge number.
Yes.
So it's very important to raise awareness about this condition and especially debunk the myths about Parkinson's disease.
So, Dr. Shivam, I find that a lot of people think that Parkinson's disease is something that only affects older adults, and this isn't quite the case.
Definitely we see Parkinson's disease in older population. It is much more common in people who are above 60 years old. When you are above 80 years old, the number of Parkinson, the risk of Parkinson's increases significantly. But there is an entity called young onset Parkinson's disease. And this entity, we see the Parkinson's starts at the age of 30 years, 40 years, or less than 50 years age. This is also quite common. There are a lot of genetic reasons which can cause young onset Parkinson's disease, and we do see them quite a lot in our clinic.
So this is very important because we don't want to exclude people from a diagnosis and knowing their diagnosis early. If the perception is that you have to be a much older adult to have Parkinson's disease.
I agree completely.
Now, another myth that's out there is that Parkinson's it's only about tremor.
Mm-hmm.
But you've said earlier that it's not just about tremor.
Mm-hmm.
There are other symptoms that the patients can present with.
I agree. This is a big myth. Anybody with tremor, the first thing that comes to their mind or they search on Google is, I have Parkinson's disease. Tremor is not equal to Parkinson's, and Parkinson's is not equal to tremor. There are many, many more reasons which can cause tremor symptoms. Something benign like having too much coffee in a day, too much smoking. Mm-hmm. Any excited conditions can increase and cause tremor symptoms. Parkinson's disease, tremor is much more different. And Parkinson's disease patients may not have tremor as well. Yeah. Around 1/3 of the patients with Parkinson's, they do not have tremor. They would just come with stiffness, slowness, difficulty in balance, and walking difficulties. And imagine somebody who is 75-year-old, 80-year-old, who is coming with these symptoms. The first thing you will think about, maybe they have some spine issue or joint issue or bone issue. Mm-hmm. But we don't think about, could this be Parkinson's disease? Mm-hmm. That's important. They need to be evaluated by a neurologist to understand, do they have underlying Parkinson's disease or it's something else?
Yeah, and I suppose they're passed as, they're old, so this is an old person's, old people find it difficult to walk. So the other myth is related to mental health and emotional well-being, because you mentioned that while there's a lot of motor, non-motor includes mental health, and obviously emotional well-being is connected with your mental health. Mm-hmm. So what do you see in your clinic?
As I mentioned previously, Parkinson's disease, there's a loss of a brain cell in the brain which makes dopamine. And dopamine is a hormone which is linked with happiness and also movements. So whenever you have Parkinson's, we see we see around 60 to 80% people with Parkinson's disease having significant mood symptoms, anxiety being the most common, constant worrying, things about what will happen today, what will happen tomorrow, not able to sleep well at night, having low mood symptoms, feeling indifferent to the surroundings, meeting the friends but don't feel like happy. It's a small thing, which is a very minute thing, but still the person is worrying too much about it. These are some examples of what patients suffer from. And this is all because of some chemical disturbance in the brain, which is linked to the underlying deficiency of dopamine in the brain due to Parkinson's disease. I see that many of my patients, when they are on the medications for Parkinson's, they're doing very well. Their mood is fantastic. They are back to their life. They are exercising. They are having a good time with the family. We have patients who are going back to driving and doing all sort of things which they used to do before Parkinson's diagnosis. So mood plays a big role. And the movement and the mood is closely linked to each other. Exercise, when they do exercise, they feel the mood is better. They can do, their movements are much more relaxed. Their tremor is better. But when they are sad or stressed, the symptoms are much more prominent.
They tense up, yeah. So that's another myth. People with Parkinson's should not exercise. That is not true. We want our patients with Parkinson's to exercise, obviously safely.
I completely agree. So exercise is the most essential treatment for Parkinson's disease. If someone tells you, I have $1 million treatment and that is for Parkinson's and I'm going to sell it to you, give me $1 million, that is exercise. You can get this treatment for free, right? You just need to go on the treadmill, go on for walking on the Corniche on the nice weather. Just do 30 minutes of walking, 30 minutes of cycling, aerobics, whatever you can do, which increases your heart rate, make you sweat. And 5 days a week is sufficient for you to improve your mobility, improve or slow down the Parkinson's progression. As long as you're not having falls, as long as you're safe to do exercise, I would strongly recommend that exercise is number one treatment for Parkinson's. If you're not able to do exercise because of Parkinson's symptoms, we need to optimize your medications. Once we get your medications working, you should be able to exercise. That's a goal.
And absolutely. So for us, we would refer patients to our physical therapist to assess the patient, and then they can also recommend exercises. Because if patients are a high falls risk, and you can understand the family are concerned about them doing exercise because they don't want them to fall and get injured. But there are exercises that can be done in a chair. So working with our other team members, our allied health, is very important for treating patients with Parkinson's.
I agree completely, Emma.
Yeah. So another myth, and it's, for me, it's a sad myth because we lose our hope when we think of this. So patients think, oh, there's no cure for Parkinson's, so why bother going for help or treatment? The prognosis looks very bleak for them. But you and I both know that with a chronic condition, it's about living well with your condition, and that's why it's so important to meet somebody like you and our other movement disorder specialists in the country to try and dispel this myth and have you get the most from your life with your family, whether it's living at home or going to work. Would you agree?
I agree completely, Emma. No, Parkinson's disease doesn't define a person. There is a person inside that. And we have to explore that personality. Even though their facial expression is down, even though they are not able to move much, but they're feeling everything. And we have to understand that there is always a hope. You know, there are so many advances in treatment now with scientific advances in Parkinson's disease. The medication works very well. If the medications don't work, we have new advances. We have infusion pump therapies. We have this new subcutaneous phospholevodopa treatment, which we are already using routinely in our patients at Cleveland Clinic Abu Dhabi. And then there is deep brain stimulation surgery for patients who are eligible for that. And we know that these medical therapies, they work like a magic. The patient should understand that it's not curable. We don't have a cure for Parkinson's, but it's about quality of life. How can we make your life better? I'm not able to go to the bathroom, I'm very constipated, and that's really bothering me. That's a symptom. If we get rid of that symptom, your quality of life will be much better. If I want to go out and swim on the beach, I cannot do it because my hands are stiff. I cannot swing my arms. We can give you the medications, we can give the exact physical therapy exercises to swing your arms better. So you can do the exercise. You can go out on the beach and swim. That's what matters. The quality of life, that's what matters. And that's our ultimate goal with whatever treatment we do, from exercise to medications to advanced treatment options like the phospholevodopa carbidopa infusion pump or DBS surgery. So any new advances in the future.
So there is a lot of hope for patients, and like you said, it's about living well, working, being able to go to work, financially support your families. This is what our goal is, and this is why we want to raise awareness about Parkinson's disease. But we have patients who, they don't really like to take tablets. But our message today is it's not all about the medications. We know that there's a cycle. Like if you go out to the mall and you've got a lot of tremor and you feel people are looking at you, that's going to affect your mental health and your emotional well-being, and you'll isolate yourself. But taking the medication, getting your confidence to go outside again, it's all about, like you said, the quality of life.
I agree.
Now, you and I are both very privileged to be working here in the United Arab Emirates, in Abu Dhabi, in Cleveland Clinic. But I was wondering, have you noticed any differences in the perceptions of our population here in how they perceive Parkinson's disease and Parkinson's treatment? Have you had any challenges in your clinic or practice?
So I had experience of working in US when I was at Mayo Clinic in Rochester, Minnesota. And I've also worked briefly in India as well as my hometown. And I have seen how things are different in different parts of the world. My goal and now our goal with the entire team that we have here at Cleveland is to really get the holistic approach, right? To get everybody, all the team members involved and see how we can help our patients. Patients here in Cleveland, I think there are some cultural differences. The patients are I see a very strong bonding between the patients and the doctor. When we meet in the clinic, it's about meeting your own family member.
I agree.
So this is something that a unique bond that we develop with our patients, and I'm very proud of it. At the end of the day, I feel good. I feel like I'm doing something for one of my family members. I'm trying to help them out in some way that they are better.
Yeah.
And the sense of caring amongst the family members, we have a very strong social support here.
I agree.
Compared to other places in the world, I see that a Parkinson's patient, old elderly man or elderly woman, she is or he is not coming alone. There's always some family member, a daughter, son, grandson, or somebody who is coming with them to support them and to listen to the doctors. I feel that this sense of belonging, the sense of comfort, it is very helpful for overall success of the treatment. Yeah. And even if you come alone, we try to make their visit to Cleveland Clinic very comforting with our nurses, with our support staff, with our interpreters, to make sure that they are comfortable coming for the doctor's appointment at Cleveland.
I agree, because we walk the journey with our patients, and it's not a once-off visit. The patient will have to come back to us at various intervals depending on stages. So it's very important, like you said, to build up that trust with the patient and their family. I noticed that the family you'd suggest something and the family are already on it. They're always, where can I do this? How can I do this? So patients out here many are very fortunate to have the family support that they have.
One more point I want to add is when we do this deep brain stimulation surgeries, right? This is advanced treatment for Parkinson's that we are the only hospital doing it in UAE. And in US, in Europe, people shave their heads to do that surgery. But in UAE, we are respectful of the culture. And when we have any female patients doing the DBS surgeries, we don't shave the head. And this is very, very important aspect. So we have culturally modified how we can do the treatment safely with respecting their cultural boundaries so that patients feel comfortable. They are at home. They can always contact us through the Cleveland Clinic application, and you have amazing nurse coordinator, Emma, to contact for any of our patients who need help with regard to movement disorders or Parkinson's disease. So this sense of comfort is lacking when I was there in US at Mayo or other places. So this is unique to UAE, and I'm very proud of it that we are privileged to to work in this part of the world at Cleveland Clinic Abu Dhabi.
I agree. Even for the interpreters, they get to know our patients, and I would call on the interpreters as well to help if I'm calling them, because they have built up that relationship. Now, we're wrapping up slowly. I want to ask you, have you any tips or any practical advice for anybody who's got a new diagnosis of Parkinson's? What do you suggest?
So first of all, I would say that when you have the diagnosis of Parkinson's disease, it's big news. It's a big shock. I understand, and I have seen thousands of patients going through this, and I know it is not easy. It is quite challenging. Time is the best healer. Once you are understanding this condition, you know about this condition, you get more instructions from your doctor, from your nurses, from the online resources, you will feel more reassured. I think it is very important to have the right information that you need.
Agreed.
Many times I see patients, they feel overwhelmed. They feel very tensed when they search the word on Google and they find images of patients on wheelchair or on the bed, which is quite distressing to someone who is young with Parkinson's, with a young family. But we have seen patients who have like 10 years, 20 years of Parkinson's, and they're still going on for marathon. They're still doing their cycling. They're still driving. So Parkinson's is very different. Not every patient of the Parkinson is similar.
I agree. They're so individual.
So individual. And the treatment, of course, is customized based on their symptoms, based on how they're doing. So I would say, don't be scared. Be open to the discussion with the doctor, with the nurses. Try to see what can help you. Anxiety, fear, stress, we know that these are the things which can worsen the symptoms of Parkinson's. That will not help. Instead, try to direct your energy into more positive form, like doing exercise, doing mindfulness, relaxation techniques, breathing exercises, join things that you enjoy with your friends. Give time for your body, for your mind to heal away from the stress of your work. That is the key lesson I would take at that end. And follow the advice of the doctors. Make sure that you have a good dietary practice. You have a good regimen for your sleep. Bowel care is very important. We know that the bowel is our gut is linked with our brain with regards to Parkinson's disease. So when we have people who have severe constipation or issues with gut motility, we see the Parkinson's symptoms are more affected. So it's very important to have a good gut care, and we can, as a doctors, as a nurses, we can suggest what's the best treatment or best supplements to take for that, and making sure that Parkinson's is not the entire focus in your life. Take yourself as a person. Parkinson is there in the background. I always tell my patients, don't think that you have Parkinson's. Think that you have already won over Parkinson's disease. I am normal. I am doing fine. I'm taking my medications. I'm following my doctor's advice. My Parkinson's is under good control. If you have that set of mind, I think nothing can touch you.
I agree. Another suggestion I would have for somebody who's newly diagnosed is maybe to keep a track of their symptoms, a motor diary, or just write down how you feel after your medicines, or the certain times a day that you feel your symptoms are worsening. So that can be very helpful if you go to your professional to seek advice. And I think for families, very important to remember about mental health, and we want really to empower our patients. So I'm going to end our podcast today. Dr. Shivam, I want to thank you for discussing and helping us debunk some of these myths that are out there about Parkinson's disease. And for our community who are listening to this podcast, if you have a loved one or you have a friend or a co-worker who may be suffering with Parkinson's disease or suspect they may have it, please encourage them to watch our video, our podcast here, and reach out to a movement disorder specialist for help. Thanking you from Cleveland Clinic Abu Dhabi. My name is Emma. Take care and stay well. Thank you.